Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner.
Yes, you are. You are that.
Yes. I'm joined today by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. I was going to call you my happy co-host because it's Easter time.
Yeah, I love Easter.
My very happy co-host. Cue the bunnies.
Yes.
Cue the eggs. Or am I the only one who has always found that bizarrely odd to make children hunt for eggs? It seems very phallic in a way.
Yeah, well, that's fine. But when you have young kids, anything to get them out of your hands and away from you, doing something that they're interested in is actually like a godsend.
Did you guys ever have an old egg in your house? That was not hard boiled? No. From an egg hunt, an egg that was never found?
Oh, no. Yeah. We've never had that. Yeah.
Yeah, I remember that as a kid. It's all fun and games until there's an egg found.
Now it's
3 months later
from China with candy in it.
Yes.
So. Yeah, my parents always hid them in the yard. So there were a couple unfounds, but then they
outside
would just
eggs.
rot outside. So it was all right.
So,
what's the topic today, Amy?
So, Dr. Martin, we have a great two-parter. So this is part 1 of 2. So there will be a part 2 coming. This is part of our Everything You Need to Know series. This is all about brachioplasty.
Let's go.
So we did do an episode called Everything You Need to Know About Brachioplasty. Nils, was it in 2021? I think.
Yeah, I think so.
It's been quite a few years ago. So it was kind of an all-in-one, but we're doing it again and we're breaking it down into 2 parts. So the first part, we always start out with the statistics. So brachioplasty is also an arm lift. Or an upper arm lift,
or an arm tuck, Amy, an arm tuck.
There is. See, I thought we busted that myth in our last episode.
That was for Nils.
Yeah. And I think
that was Nils.
And I think I said, "Where are you tucking it to?"
You're tucking it away.
Yeah, no, we're cutting it away. So we finally have statistics from 2023. So in 2023, there were about 23,000 upper arm lifts done by board-certified plastic surgeons. The distribution I found pretty shocking, actually, that there was only 2% of brachioplasties were done on men. So 98%, at least from board-certified plastic surgeons who reported in the year 2023.
Which would be primarily the people that do this. And to put this in perspective, 2023, this is off the top of my head, somewhere close to 180,000 breast dogs, maybe 200,000. So you have a lot smaller number, but the fact that it's only men makes no sense with all the weight loss that's occurring. Maybe this is 2023.
Well, I think what it really shows, though, is that this is a problem that is uniquely female, right, even for those who haven't lost weight. And I think that's what we really see with this, is that there is a very much a hormonal component of skin integrity and also muscle density.
Muscle mass, for sure.
That men have a little bit of a preferential ability to not need this procedure as much as women. The other thing I found really surprising was that, and we found this to be the case as well, that the amount of people over the age of 55 who get this procedure done is actually not small. So if you take 55 to 70 plus, that's as many people in the 40 to 54 age group doing this procedure.
It's as much as 25 to 30%, at least of the numbers that were reported.
So you're not too old. This is a question we get a lot from listeners who are like,
we get this question all the time.
Am I too old to have XYZ procedure?
And Amy, almost the age of when people are saying, am I too old?
I know.
We're not too old.
Trust me, I'm already at that age. And when people say that to me, I'm like, absolutely not. You're not too old. So yeah, brachioplasty is something we do, I'd say, a fair amount of. It's not like the most common procedure, but we actually do, I think, a fair amount. We do more than most
people.
Yeah.
So.
At least in this part of the country.
Yeah.
And that's going to vary based on where you are. So
we also did a brachioplasty myths a couple years ago. So that's a good, one if you just want to break down some of the myths and everything else. But this is going to be way more comprehensive.
And I know we're not going to have a lot of visuals on this, but there's actually a video on Jason Martin MD's YouTube channel under Jason Martin's videos. There's actually a good brachioplasty video on there, which shows all the incision sites.
Yes, which actually brings up a good point that Dr. Martin, you interrupted me, which I'm not saying in a bad way.
Yeah.
Asking me what episode we were doing before I was able to tell everybody about our social media.
Yeah, of course. What are we doing?
So if you are listening to this podcast and you'd like to watch it, we are on YouTube and you can find all of our social media links
That's
here.
That's why I brought it up.
Including the video, Ding It Out, Dr. Martin, that Dr. Martin was discussing is right there.
Nils will be able to find it.
It's on our YouTube channel. Yeah. It's actually a really popular video. So Nils and I were talking about that before we started. So
let's go.
All right. So let's talk about what a brachioplasty is. What is an arm lift, or what does an arm lift do? So on the very base level, it removes or reduces loose skin and excess fat of the upper arms, or the dreaded bat wing.
Right. And that would be between your armpit and your elbow primarily.
Yes. And that, we also tighten and smooth the underlying supportive tissue. So kind of reposition that, supportive base before we redrape the fat. And we'll talk about that in part 2 when we talk about the specifics of surgery.
At least when I do it, there's a lot of liposuction involved. So we remove a lot of the excess fat, or almost all of it.
Yeah. Yeah. And are just able to kind of smooth out the appearance.
Exactly.
Yep. All right. So what are the different types of arm lifts, Dr. Martin?
Well, considering I call them arm tucks, I just want to go back there again. But arm for brachioplasties, there's a full brachioplasties are what is most common. Full brachioplasty puts an incision from your elbow down to your armpit. Yeah, she has it right there. Nice. Yeah. So we have these.
That's the inner arm incision.
Yeah, inner arm incision. Mm-hmm. So that's going to be the most transformative. Besides something that might be extended, that's going to solve a majority of the people's problems. Most people present with loose skin and soft tissue and fat from the armpit down to the elbow. It's not usually just kind of contained up near the armpit area.
Yeah, and that extended can be extended in a couple of ways. I mean, there are rare times where we'll extend past the elbow.
Yep, I did that the other day. Yep.
Most commonly, though, we're extending it actually into the side or the torso. Right. Kind of down from the armpit along the rib cage,
right,
to kind of grab that excess, because a lot of people who do have excess skin of the arms also have excess skin of that kind of like armpit,
right?
Like towards the back.
Especially with weight loss and these GLP-1s, the change in the types of patients coming in with 70 to 80 pound weight loss, they almost always have laxity or looseness that goes through the armpit down onto the chest wall, and specifically what you consider where the bra line comes around. So you can extend the brachioplasty scar or incision through the armpit down onto the chest wall.
Yeah, but then you also have a mini or a short incision, or what we even call like a mini, like an axillary only, which is even more rare. So I think
we did the mini.
Yep.
Like a couple weeks ago.
Yep.
And I was pleasantly surprised. Normally those are kind of hard to make a big change, and she had a really nice change.
She had a really good change, and she, is a very, very slight patient, and a lot of our patients are, they've never been overweight in their life. So she was fine with the incision coming several inches down the inside of her arm, but not all the way to the elbow.
Not all the way. Yeah. She wanted it to be covered by a polo shirt.
Yeah, like short sleeve shirt. And so we did that, and it looks great.
It looks good.
Yeah.
And we did Body Tight also. We can also talk about that later on. We combined it with Body Tight. So yeah, I think the minis, everyone wants a mini. Most people aren't a candidate for it.
Everybody thinks they want a mini.
Right.
Because that sounds better.
It does sound better. And then you can have combinations of all these. I've taken out just axillary or armpit tissue before. I've done a full going to an extended that was then connected with a breast reduction scar.
Yeah.
So we're talking about the types, but really it all kind of denotes the type of scar you're going to use. Just remember though that a full brachioplasty treats the arm from the armpit to the elbow, and a mini only does the upper third at the most.
Yeah. And an axillary does even less.
Yeah, an axillary would be the armpit.
Really
area.
Just in the armpit.
Yeah.
And that's, these pictures kind of show that. The picture shows it as a minimal, what we're calling the axillary, and you kind of see where that incision goes. There's not going to be much change.
Yeah.
We don't tend to do the back of the arm incision. We've seen patients who've had it done, and people are fine with it. We talk a lot about scarring, and this is, I think, the thing that scares people about this procedure. The way you place the scar is the first one, the inner arm incision, which is kind of when your arm is down, you don't see it. There are doctors who do the back of the arm, which is straight down the back. And
well, the problem with that is
it's visible.
Right.
Always.
So, I mean, we got to have a discussion about this. So anyone listening, just put your arm out. Nils, put your arm out, right?
Well, I'll do it.
You put it out for 10 seconds and then you start to feel, you feel your shoulders. So you can't keep your arms out.
Most people don't.
No,
it's just not a natural thing to do.
A normal resting position where your brain's not thinking about it is with your arms straight down. If you put it on the back of the arms, you can see a line down the back of your arms with short sleeve shirts on. If you put it inside the arm, and if you're looking on our YouTube channel, when you're watching this, from the elbow to the armpit, inside the arm, the demarcation between the biceps and triceps muscle, that crease, if you put it in that area with your arms down, you don't see it.
Yeah, even with a tank top on, you don't see it.
Like 95, 98, 99% of the time, your arms are down almost all the time, because it does take a lot of energy to reach up to hold your arm out. So I just really don't feel the back of the arm incision. I don't think it looks good. I've seen them. I don't like it. Yeah. So that's my professional opinion. Other people may have a different opinion, which is fine. But I think kind of keeping it more on the inside of the arm is better.
I just find these pictures so funny. Like, what's she doing with her?
I don't even know.
Like touching the back of her head.
Yeah. It's like,
yeah.
It's like she's like
like does she need to be in repose?
No, it's like the Rubin, the painter that had all the whatever.
Yeah. All right.
The Rubin-esque kind of female.
Yeah, no, very much.
Yeah.
So let's talk about who is a good candidate for this procedure.
Right. So for sure, someone with excess skin between the armpit and the elbow, and preferably excess fat, because you can get rid of both of those at the same time.
Well, not preferentially. I would say a lot of our patients don't have really much excess fat, if any. Like a lot of our patients really just have loose skin.
Sure.
So,
yeah.
I mean, think about it. Most of our over 65 patients don't have a lot of fat there.
I agree. I do think that you can have more of a transformative result if you can take out fat and skin, but you're right. Absolutely.
Yes.
Yeah.
I mean, but again, we're not in it. It's not our transformation.
It's true.
So yeah,
it's true. It's theirs.
You just need to have excess skin. And, of course, if you got fat, we take care of that too. You have to be healthy enough for surgery.
What are you talking about, Amy?
Always. This is a really important one. Being a non-smoker for this is a surgery that's has a lot of incisional area. You think about it, it has probably more incisional area than a lot of other surgeries that we do based on how tall a person is and how long their arms are.
Right. I mean, the only one longer is probably tummy tuck or body lifts, or maybe vertical thigh lifts.
You would think a tummy tuck is about the same.
Yeah, it's about almost the
one
same.
side.
Yeah, especially if you go into the armpit.
Yeah, and that's just one side, and you're doing it on both sides of your body.
Very good point.
So, there's a lot of incisional area. Smoking is going to make it so your wounds potentially don't heal. Like, it's really important that you not be smoking for this procedure.
Yeah.
Like, very much. Being at a happy, stable weight is also really key, because if you are seeking this procedure following weight loss, you want to make sure that your weight is stable. And that's just a weight that you can be happy at. I think that, Dr. Martin, you brought up GLP-1s. If you have recently lost a lot of weight, most doctors would probably like you to be at that weight for at least 6 months, preferentially a year.
Yeah, 12 months.
To give that skin a chance to bounce back as much as it will.
Yeah, and also to prove to yourself you can maintain it, preferably on a maintenance dose of GLP-1s or off of them. So
yeah. So that's what I mean by stable, happy weight. Like, it's just a weight that you can maintain.
Right.
If you are young and planning future pregnancies, keep in mind that you may need revisions. That's totally fine. Doesn't mean you can't do it now, but just think about stuff like that. Good skin integrity and muscle tone. These are going to be things that are really helpful. Dr. Martin, you brought up the results part of it. Now, is that going to make your results as good as possible? Yes. Can you still do it if you don't have the best skin integrity? Yeah.
That's what we struggle with in our office, because we have patients that are older, and that generation tended to not strength train. It was not culturally common. And so these women who are in their 60s and 70s come in with a paucity or just minimal like muscle mass in the arms. And so you try to convince them that strength training is really important, not just for your quality of life, but also for your appearance.
Well, no, it won't completely resolve those aging related changes of the skin completely. It will make them a lot better, but the better your skin is going in, the better your results are going to be.
And the better the foundation, which is the muscle,
yeah,
the better your results are going to be.
Yep. So those things are the results part of it for sure. Yeah. Going to make your results as good as possible.
The other thing that people like from brachioplasties, at least with our patients, is like Amy said, they don't have a lot of fat, but they have this, with their arms down, their arms, the outside of the arms kind of has this almost cellulite-y, wrinkly skin appearance that just really bothers them with their arm down.
Yeah, it's shrivelly.
Shrivelly looking, kind of cellulite-y looking. They just don't like the appearance. And a brachioplasty can almost get rid of all of that just by mere fact of pulling the skin tight and creating some tension around the arm.
Yeah, with a full.
With a full, yeah, not a mini.
Mini is not going to do it. And also a positive outlook always for surgery. You want to have a positive outlook and realistic expectations and goals. And that's really key. Mm-hmm. That's the part that is always going to be a challenge with people and expectations, right?
Yeah, we're expectation surgeons.
Yes.
Yes, that's what we do for a living.
Exactly. Yeah. All right, let's take a quick break and we'll be back for the remainder of part 1.
Let's go.
And we're back. So now we're going to talk a little bit about how to choose a surgeon and what to expect at your pre-op appointment. We're also going to talk about the risks and complications of this procedure in this part.
Okay.
And then everything else about the surgery and about recovery is coming in part 2.
So we know for a fact that you need to search out a board-certified plastic surgeon. Is that correct?
Certified by the American Board of Plastic Surgery if you're in the United States, or the American or the Canadian Mountie College of Plastic Surgeons.
Mountie College. Yeah. Okay.
Ye Canadians.
Yeah.
So if
they're board certified by any certification that says cosmetic surgeon in the title, then it's not legit.
Yeah, it's not part of the American Board of Medical Specialties. Yeah. So that for sure. Results in aesthetic that match your desired outcome. This is something when you're dealing with a lot of scar, especially a scar that is potentially visible in certain situations. I think that's probably the most important thing to talk to the surgeon about.
Right. And I'm extremely prideful about how my scars look. They look great. I show people real pictures, even pictures that are within a month of surgery, within 4 months and 5 and 6 months. And I'm proud of them. And you want your surgeon to feel the same way. It's not like, yeah, you can get rid of skin, but if they have janky scars and all irregular looking, you don't want that, right? So you want to make them as best as possible. This is one of those few areas that could be visible.
Yeah.
So you want to make sure you're going to someone who's technically sound.
Yes. And somebody you feel comfortable with.
Yeah. Also, you can talk to. They seem like they have your best interest in mind. Maybe that they share your views on aesthetics. That would be good too. Like maybe what you want, they agree with.
Aesthetics that match your desired
there we go. Yeah, there we go.
Yeah.
Someone you're comfortable with.
Yes.
It's on the slide.
It's on the slide. Yeah, we have a great episode. It's a couple of years old now about how to choose a plastic surgeon or how to choose a surgeon. It's amazing. Nils will link it in the description box below. New Beauty Guide, How to Choose a Surgeon is awesome. So definitely listen to that because that advice still rings true today.
Yep.
All right. So at the consultation, what are some basic things that somebody should expect when they come in?
Yeah. So first and foremost, you are a patient. We are doctors. Amy is Amy.
I'm Amy.
Yes. Amy's an Amy. So we're gonna treat you like a real patient. We're gonna get your past medical history. And what does that include, Amy? Medications, allergies, the illnesses you're suffering from, previous surgeries you've had.
Smoking history.
Smoking, how much you drink, what supplements you take. I go into what orthopedic procedures you've had on your shoulder and your elbow.
Yeah, any surgery you've had on your arm.
Yeah, do you have any sensation or nerve issues? Do you have something wrong with your spine? All these things are super important if you're thinking about doing a brachioplasty.
Yeah. And, the other thing too, the doctor can kind of guide you on what your options are and what that likely outcome will be.
Right.
We'll also give you a quote for that procedure, talk about the risks and complications, which we're going to do on our next slide, show you before and after pictures with similar outcomes or similar people to you. And I think that's what's really key. People look at a lot of before and after pictures online or on RealSelf or on Reddit or whatever, but you really can't tell a lot about a person from a picture. You think you can, but you don't know how tall they are, how old they are in some cases. So seeing pictures of people in your age group with your presentation is going to be the most
helpful. Preferably with your skin type too. Yeah.
Yeah, that's what I mean. Like your age group, your everything, like your history of life is going to help a lot just to give you the best idea possible. And of course, answer any questions that you have.
That's why Nils hasn't had plastic surgery because there is no Nils. There's only one of one.
He's an N of one. He's an N
I can't show any other pictures. He's a Viking. And there's no more Vikings left on this earth beside Nils.
I think there's other Vikings left.
There can be only one. I hunt the others down.
You're so special, Nils.
There can be only one. So some questions to ask your surgeon. These are always in the description box of all of our videos. Number one, are you certified by whatever certifying board in your country? In the United States, it's going to be the American Board of Plastic Surgery.
Apparently the plastic surgeons in Canada ride horses, but I'm just going to...
Doesn't everybody in Canada ride horses?
Yeah, I think so.
Yeah.
That's not pejorative. Okay.
I mean,
we're going to be nice to Canada right now, okay? Really my brothers and sisters. It's okay. Yes. We love you.
Our neighbors to the north.
Yes.
Do you perform surgery in an accredited facility? This is also very important. Now, if your doctor is board certified by the American Board of Plastic Surgeons, they have to. That is a requirement of maintaining your board certification, that you only operate in accredited facilities.
Yeah.
This is a good one. What specific training do you have in brachioplasty techniques? Because this is a surgery where you do need a pretty, full advanced ability to close an incision really well without tension, how to anchor things if you need to.
There's so many parts of this. And we'll talk about it in the next episode, but You don't want to take too much skin, but you have to take enough. You have to liposuction well. There's nerves that run through this area that are extremely important. You better go to someone. Yeah. And you do not want to go to someone who's going to mess this up. This is extremely important because your arms are so critical to your functionality.
Yes.
Yeah, I mean, the surgical technique, we'll get into that again next episode, but the surgical techniques can vary, and I think you just need to go to someone who's confident with theirs and can show good results. Just FYI, in my training, I did tons of brachioplasties, and it was so funny. They were kind of hard to recover from in the old days because they were pretty aggressive. And as we improved our techniques and did some less aggressive liposuction, and I don't think these surgeries are that hard to recover from.
No, they aren't. Arms in general, because they are mobile, tend to be a little bit easier to recover from. And they're also, they have just better lymphatic drainage, blood supply, everything because of the position versus like a thigh lift.
Right. Yeah. Oh, by the way, if you've had breast cancer and a lymph node biopsy, these are things in your past medical history that are going to be very important to me, just FYI.
Yeah.
How are complications handled? That's a really good question. Will they take care of you? Do they look you in the eye and say, I'm with you no matter what happens after this? We're going to work together. Do you get that feeling that they would take care of you if something were to go awry? And those things can happen. I think that's extremely important.
Yeah, this one's really important. We touched on pregnancy and weight loss or weight gain, but how would those things affect your results? If you're in that stage of life where you are considering future pregnancies, if you're like, I'm going to get pregnant right away, like this is my goal in the next year, we'll probably tell you to wait on surgery. But if you're like, yeah, that's in my like 10, 20, 15-year plan, like that's a little different. Continuing to lose weight after this procedure is also not something that's going to be super advisable. So because you want to make sure your results are going to last. So you want to be at that happy, stable weight. What can I do to maximize my recovery results? Well, you can definitely follow your plastic surgeon's instructions for recovery, number one, and we'll talk about
and pick up your prescriptions.
Get your prescriptions filled. Yes. This one is something that I think people ask, but they don't think of the component of how much help they'll need. They ask about recovery, like how long is recovery, but they don't always think like how long will I need somebody to assist me during recovery? And that's an important thing to ask as well.
Yeah, especially since brachioplasties in our practice are usually not isolated. We usually do it with other types of procedures. So you're going to need help after this. When your arms are limited in terms of range of motion, how much you can lift, that's really going to affect your daily life. So you're going to need help at least right away.
Yeah. You might not be able to drive for a few days. Again, like those are important things to plan for.
How can I expect my arms to age over time? Well, if you keep lifting weights, awesome. No, we ask this question every time, and really you can't stop aging. So the brachioplasty will reset everything. From that point, though, you're going to continue to age. Things will loosen up. You may get loose skin again. I've done some revision brachioplasties before.
It's really rare, though, unless a person has had a pregnancy or other weight fluctuations.
Yeah, and it's usually people that really fluctuated in weight went back up and then back down again.
Yep, or lost additional way more weight, and that's why we like that stable weight.
Yeah,
I think a brachioplasty, it's kind of like a tummy tuck. If you time it correctly and your weight stays stable, it is likely a one and done. It's not as much something like a facelift where we give somebody the expectation that yes, in 5 to 10 years, you're probably going to, need a touch.
To this point, we have never redone a brachioplasty of mine because they had laxity of skin.
Correct.
We've done a few scar revisions. One of them was someone with very dark skin that we already knew would keloid. She was a keloider. She is a bad healer of scars. She didn't care. She had such laxity of skin in her arms. It was more for her functional benefit. And we knew we would have to do a scar revision. So only a few of those. I can't remember ever doing more skin and soft tissue. I have from other surgeons that I don't think did the brachioplasty enough. They were pretty conservative, which is better than too much. So
yeah. And then pictures of what's reasonable to expect, I think is a great question to ask. So I decided to put risk and complications in this episode. Usually we do this in part 2, but I shrunk it into part 1 this time just so we kind of talk about it with that. Those are things you should know before you schedule surgery. I think that you should understand the risks and complications of a procedure before you're scheduled. So that's why I moved it up. I moved it up
I like that. That's probably better.
An episode. Yeah. With any surgery, this elective surgery is still surgery. So you're going to have all the same risks of any surgery. And that includes things like bleeding, infection, need for additional surgery, DVT, pulmonary complications, bruising and swelling. But there are a couple of things I think are unique.
And most likely these are done with anesthesia, either IV or general anesthesia, tubing down your throat to help you breathe. You can do these under local. I have done that. It's a little harder. Sorry, go ahead.
Yeah, like especially like a mini or an axillary. It's challenging for positioning mostly.
But we do under local.
Yeah.
I have.
Oh, that's why I said we can. We have, and mostly just minis, just because the positioning and the time in that position it can be challenging for the surgeon and the patient. I mean, it can be awkward for everybody. You don't want to be moving your arm around when it's being sutured on. Not good.
Stop moving. Yeah. Stop moving. Yeah. That's basically, that's me yelling at the patient. Yeah. I love you. Stop moving, please.
Some things that are, specific definitely with this procedure, as Dr. Martin mentioned, there's a lot of nerves that run all through the arm and through the shoulder region in general. So changes in skin sensation or numbness or pain that persist following surgery, that is definitely a unique risk to this procedure.
If you feel like your hands are almost numb and swollen, I mean, you concerned with vascular compromise, or the blood flow is not getting down there, or the nerves may have been affected. So
or even just like the way the skin feels, like may forever be a little bit different. Mm-hmm. That's definitely a risk of this. Mm-hmm. I put suture abscess or suture extrusion on here because it is something when you have an incision that's this long, especially in an area that's mobile and that's not got a lot of soft tissue underlying it, your risk of having like a little internal suture poke through the incision line is definitely there. And it's not that I always say this on these risks and complications, these aren't like unrecoverable things. They aren't terrible. It's good things to kind of know that like, okay, well, I have a lot of incisional area. It may take a while to heal. I might have a little suture poke through occasionally. Like It's all okay. Seroma or hematoma, like having, fluid collection, we usually put drains in, especially with full and extended for sure. Yeah. For just a couple of days to take the pressure off.
It's just a few days. And since we use drains, I can't ever remember seroma we've ever had in the arm. Such a small space, and the drains only need to be in 3, 4, 5, 6, maybe 7 days at the most. So I think drains are like a nothing thing, but again, the internet goes crazy on drains.
I know. Especially with this, they come out so quickly.
If I was a new surgeon, I would just say I hate drains. That would be my website. IHateDrains.com.
Or you don't need a drain.
Everybody would come to you because they fear drains. Drains are like so inconsequential.
Drainlesssurgery.com.
Yeah, exactly.
Unfavorable scarring. Again, Dr. Martin touched on this with the need for a scar revision in some cases. Again, that's something that can almost always be fixed.
Asymmetry is a real risk. Mm-hmm. This is why you need to go to someone pretty good, because it's hard to mimic one side to the other. If you think about it, you make one side tighter, and then you have to go mimic the same amount of tightness on the other side.
And there's differences. We all have a dominant arm.
Right. And so that's where the wheels fall off for some people. You'll see they'll come in, and if they hold their arms out, like they're flexing for someone, you'll see this irregularity where the arm just doesn't flow smoothly underneath. And that is just poor technique. And we've seen that a lot. Mm-hmm. And that's frustrating. So every now and then when I do these, if it's like a real big brachioplasty, it won't be perfectly smooth right after surgery because I took out so much tissue and it's tight and it's swollen. But within a couple of weeks, they almost look perfect. So you'll have some asymmetry after surgery that's inherent, but long-term asymmetry is a risk.
Yes, it is. And again, I think with a lot of skin excess, you may not really understand that there is a difference in your arm side to side. Like you might not be able to perceive that asymmetry prior to surgery. So that's an important thing to kind of talk to your surgeon about. Like if you are having a lot of skin removed, and you feel like maybe you do have one side, one arm that is really your definitely more dominant arm. That's the things to kind of keep in mind prior to surgery. I always tell people, like our bodies side to side are sisters, not twins. We are not a carbon copy of ourselves side to side.
Yep.
They're little asymmetries.
I was just telling you a story about twins.
Yes, you were.
Yes, I was.
You have twins in your life.
Yes.
All right.
Better for bad.
Yeah. Well, when you get a twin, you kind of got your twin.
There's no way around it.
No.
Yeah. All right.
All right. So that brings us to the end of part 1. Dr. Martin, do you have any closing thoughts about part 1 of brachioplasty?
Yeah, I love brachioplasties. I know that people fret about the scars, but they are some of our happiest patients.
Oh, yeah. It solves the problem.
Legitly. It solves the problem. Their arms look amazing afterwards. It's super transformative. You see the befores and after. All you got to do is go on my website and do the scrolling effect of like before, after. It's crazy how much different their arms are. And the other thing about brachioplasty, honestly, there's nothing else you can do. Mm-mm. You'll go to the gym and the person will be like, put the muscle on. You could really fill out the skin. I'm like, I've been lifting for almost 10 years now, and I can barely, get like even a half an inch on diameter of my biceps, around my arm. So it's impossible to do enough volume of muscle mass to take up the loose skin that's there. Brachioplasties are the best and only option. And do not fear it. If you have loose skin that hangs down, that you can't wear clothes, what's the main thing they complain of?
The bat wing.
The bat wing, but like they can't get shirts, the short sleeve shirts or long sleeve shirts, the sleeves are so tight.
Yeah.
That so they have to get like an extra large shirt just to fit their arms through the sleeve. And it's just like devastating to hear those stories. And man, you get rid of it and they're the happiest patients.
Yeah.
I'm sorry, plastic surgery doesn't make you happy. Content.
Oh no, they're happy with their surgery.
Oh yeah. Okay.
Yeah. Remember, you can be.
Am I allowed to say happy?
Yeah. I love those things that people tell us when they come in for brachioplasty consults about like why they're here. You know, the bat wing is number one.
Yeah.
But like the people, like when they're brushing their teeth, we had a patient who was like, I brush, so they got to stop, and it just keeps going. Yeah. Yep. Yeah. We hear that. Yeah. So, all right. So in part 2, we're going to cover the specifics of surgery. We're also going to talk in detail about recovery and what to expect at pre-op. Yeah, I think that's it. So again, thank you everyone for being here.
Didn't we cover pre-op? We covered pre-op. You moved it, remember?
No, we covered risks and complications.
Oh, got it.
We have not covered pre-op. Pre-op's coming.
Oh yeah, we did the consult.
Yes. Yeah, the consult. Yeah. I just decided that you should know the risks before you schedule. Like people should be informed. That's the whole point of this podcast.
That's literally what we're doing.
We're informing the people. Yes. If you'd like to follow us on social media, again, all of our social media handles are in the description box.
What if they
below.
want to call us, Amy?
If you'd like to leave us a voicemail or shoot me a text, you can do that at 303-630-9038.
What if they want to call Nils? What's his number?
It is the same.
Yep. It's the same.
It's the
Hi,
same.
I'm calling to talk to Nils.
I mean, honestly, I would love that if somebody left Nils a voicemail.
They replaced me with AI, so everything's connected now.
We got your voice enough. Record it. AI can mimic it. It's super easy. And then we got your face. So you're done, bro. You're done.
All right. So on that creepy AI note, we will see you all here next time.
See you later.